Good morning, everybody. My name is Don Neifer. I'm the Chief Veterinarian here at the National Zoo in Washington, D.C. And this morning we thought we would give everybody a window into what we do. And so, for your viewing pleasure, we have a male lion, 2.5 years old, who has a fracture of a lower canine on his right side of his face. And dental wear, dental fractures, and dental disease is something that occurs in both captive and free-ranging mammals. And fortunately, at this zoo, we have consultants and veterinarians who are well-versed in a lot of the issues and conditions that animals require. One of the consultants that we utilize is a veterinary dentist. We have Dr. Baron Hall is here today, who will be both evaluating the condition on our lion and providing some restorative procedures, if that's possible. In addition to doing the dental examination and the work associated with it, we take opportunities to acquire other information on our lion. As you can imagine, we don't have our hands on them every day. We do engage in a lot of positive reinforcement training or operant training with our animals. That allows us to get our hands on them through their enclosures. It allows us sometimes to get diagnostic samples. It allows us to sometimes look at their oral cavities, which is actually an important factor when we're looking for evidence of dental fractures or disease. However, nothing really replaces a full physical examination. And so today we'll be doing a complete systems examination of this lion, checking out all the muscles, checking out all the joints, palpating the abdomen. Depending on how long the anesthetic procedure goes, we may take survey radiographs or x-rays. We will also be performing abdominal ultrasound, not because we're looking for problems necessarily, but because we want to make sure we know what normal is for all of our individual animals. You may see us this morning drawing blood samples, either from the tail vein or some other veins on the legs of this animal. We may be administering vaccinations and other treatments, whether those be antibiotics or agents that will help with analgesia or discomfort associated with the anesthetic event or some of the dental work that's being performed. We have a nutrition staff here at the National Zoo, and at some point we're going to have one of our nutritionists come in and they will be palpating the animal, which means placing your hands, feeling for muscle mass. The purpose for that is while we get routine weights on the animals, again, nothing replaces hands-on. So our nutritionist staff will actually assess the muscle mass, assess the overall condition of our lion. And I don't know, Aaron, you want to slide in here and tell us a little bit about what you're doing?
Sure. So body condition scoring is a tool that we use in conjunction with several others to monitor our diets and how successful we are. And so it's a subjective measure of muscle condition as well as adipose coverage, basically fat mass. And so I'm going to palpate various areas of his body that we call bony processes and feel for how hard or how light I need to press in order to feel certain bones. Starting with the ribs, moving to what we call short ribs, on the hips, just feeling for how hard I'm applying pressure to feel that bony process and how far into the fat I need to get to feel that process. We also do spine, so I'll go all the way down from behind the shoulders, down the spine. And basically what I'm feeling for is making sure that I can feel each of the spinal processes without my fingers dipping too far in between each one. They should be rounded and not pointy, and that is what I'm feeling. For hips, they should be easily felt and rounded, which is what they are. Ribs, I should be able to apply pretty light pressure and feel individual ribs. Again, not being able to dip fingers in between each one too deeply. With this guy, I'm applying a bit more pressure to get to those ribs. And then with shoulders, feeling for that scapular area and how easy it is to find that bony process. We score animals on a scale from 1 to 9, 1 being emaciated, 9 being obese. Typically, we like to see our animals between a 4 and a 6 range, with 5 being what we consider ideal. And based on this guy's assessment, he's a 6 out of 9. So what that means is we will go back and have discussions with the curator and probably do a slight diet decrease to get him back to that 5 out of 9 range.
So what you're looking at here, this is Dr. Hall, and he is evaluating our dental condition on our cat. Dr. Hall, do you want to make any preliminary comments or observations of what's going on?
Sure. This lower right canine tooth has a complicated crown fracture, so there's pulp exposed. It's painful. Obviously, he's a lion. He's not going to say, ouch, this hurts. But we've already accessed the pulp cavity where the pulp lives. There's no evidence of any live tissue except way down at the apex or the tip of the root. So this tooth's been dead for a while, but fortunately there's a solid bottom, so we're going to get everything cleaned out. We're going to sterilize it. We're going to fill everything back in and allow him to have a healthy, pain-free, non-vital tooth.
Thank you. Now you guys may all notice that there's other things going on in this mouth besides the teeth. I'll point out a couple items to you. We have this lion anesthetized, and you can see where my hand is pointing. That's an endotracheal tube, which is actually going down into the animal's trachea and is allowing us to deliver both anesthetic agent in the form of a gas as well as oxygen to our lion. What that allows us to do is keep a safe level of anesthesia both for the animal and for the staff. It also means that I do not need to give this animal extra injectable anesthetics. In order for us to get our hands on this cat, we had to give the animal an injection of a combination of several drugs into the muscle. Once the cat was asleep, the team safely approaches, makes sure that the lion is completely asleep or at least safely approachable. At that point, we put a face mask over the animal's nose and deliver gas that way. There's a machine off here to the right, which actually is delivering gas right now. Once the cat has become more relaxed, we then open the mouth, and you may see a very large metal device in the mouth. That's actually holding the mouth open for us. It's not so much because we're worried about being bitten, but it's just to allow us to get access to the trachea into which we place the endotracheal tube. There's also a small clip you may notice on the tongue. That's a pulse oximeter. Some folks may have had that attached to their finger if they've ever been to the doctor or ever been in the hospital. That's looking at oxygen saturation of the blood. We can also get a heart rate off that monitor as well. You swing around here to the right a little bit, you might see another monitor. Through this, we're actually able to assess the animal's heart rate, as well as its blood pressure, and as well as its oxygen concentration in the blood. Other things we look for is CO2 levels in the animal. We can measure expiratory CO2 to make sure the animal is not becoming acidotic. And basically, that means the blood is becoming too acidic, and that can have some consequences for you or I if we're under anesthesia for a prolonged period of time. You may notice some clips on the lion's abdomen and on his chest. These are the ECG or EKG clips that are allowing us to monitor the heart rate and make sure we're not seeing any arrhythmias or abnormal rhythms in the heart. We also take temperatures on the lion to make sure that the animal's not becoming too cold or too hot. There's a cuff here around the animal's paw, and that's actually allowing us to get indirect blood pressure readings on the cat. And then we don't like to forget about what we can actually do as individuals. We put the machines aside for a moment, and often you'll see us putting a stethoscope in our ears and listening to the cat's chest to make sure the lungs are clear, to make sure that the heart rate that we hear jives with what we're seeing on all these equipment that we have in the hospital. As I mentioned, we're doing other procedures on the cat, and one thing that's going on now in the back here is we're getting a blood sample from a lateral tail vein in this cat. That blood will be submitted for evaluation of the animal's red cell count, white cell count, make sure that there's no evidence of infection or inflammation. We run a series of chemistry values on the lion, making sure that the liver, the kidney, and the other organs are functioning properly. We also bank a number of samples in case we want to go back in the future and look for titers to certain viruses or other diseases, in case we want to do some nutritional analyses of the blood for vitamins or minerals. And also because we here at the Smithsonian routinely get requests for samples from our animals that researchers who are working with them both in captive and wild situations need for some of the studies that they're performing. These dental procedures can take a variable amount of time. I believe that the only issue with our lion today is this one tooth. However, we sometimes have carnivores in particular that will have several teeth that require work. when we bring an animal to the hospital, or we decide to bring it to the hospital, we have to consider total anesthesia time. We talk about the golden hour, which really isn't very attainable for what we do nowadays in modern zoos. And that refers to from the time the animal is anesthetized to the time it's returned to its holding area, we like to utilize an hour. But the reality is, to do this appropriately and to do it well, it's going to take several hours. So this lion will probably be under anesthesia for anywhere from 2 to 3 hours today. And what's involved is, in addition to putting the endotracheal tube into the lion, in addition to placing the catheter, we have to safely transport the animal through our zoo in an enclosed vehicle and return the animal the same way. Some of the anesthetics that the lion has received have a reversing agent. So when we return the animal to its holding area, we will actually provide those reversal agents to help him recover a little bit quicker. That said, if anybody who's watching this has ever had anesthesia or undergone surgery, you don't quite feel right for at least a day. So it won't be surprising if he sleeps most of the day. It won't be surprising if he doesn't have a great appetite today. As I mentioned earlier, we will be giving him some medications that will both help with any potential infection, although the tooth actually looks pretty clean, so we're not so worried about that. More importantly, he's going to be a little uncomfortable. I would be uncomfortable, and I would want my doctor to give me something for the discomfort of the pain. So he will receive some analgesics, non-steroidal anti-inflammatory, similar to action of ibuprofen that you and I may utilize. We're going to have one of our technicians here, Devin, pop in, and she's going to sculpt the chest on our lion. As I mentioned, we have lots of machines hooked up to the boy, but we don't like to forget our own personal skill set. So we use gravity to our advantage, and what Devin sometimes you will see her do is put the stethoscope under the chest. It's a very deep chest. It can be a little bit difficult to sculpt the heart, so I'm actually going to be quiet here for a minute so Devin can do her job. All good?
All good.
All right. One thing you may notice is that this lion's chest is moving up and down on its own. That is not always the case under anesthesia. We do have the potential or the possibility or the option to actually help animals breathe. Because we have a tracheal tube in their throat, in their trachea, we're able to put what we call positive pressure ventilation into the chest to help the lungs expand. If the cat is down on one side for a very long period of time, some of the lungs will actually partially collapse. It's something that we need to monitor. It's not a huge concern, especially because this cat will not be down for that long overall. So even though the lion is breathing on its own, we use some of our devices to look at the oxygen saturation. If that saturation starts to drop or trends below what we like, Devin is actually able to close a valve on our anesthesia machine and provide positive pressure ventilation to our cat. How are we doing oxygen saturation wise?
90%, so not too bad.
Not too bad. We'd like it a little bit higher if we can, but 90 is good. And does the heart rate you sculpted match up with what's happening on the machines?
It is, yes.
Great. So a little bit of quality control on our part.
And Dr. Neifer, can you just remind us what kind of procedure Shaka is having today?
Sure. For those who are tuning in, this is a 2.5-year-old lion, male lion, who has a fracture of his right lower or mandibular canine. And we have a veterinary dentist, Dr. Baron Hall, is in today to basically clean this up, make it a functional tooth, and remove what we assume to be some discomfort associated with the fracture. And Dr. Hall, would you give us an update of where we're at in our dental work today?
Oh, basically, right now we're just, I mean, this is a very young lion, so the inside where the pulp live is very large, and so we've got to clean it all out, get all the live tissue cleaned out. There's a little bit of bleeding from some of the tissue that's down in there, but once we get this all cleaned out, we're then going to fill it back in, doing what we would call a standard root canal, and then the little access areas that we've made, we'll do restorations in those to seal it, to keep the bad stuff in, and we'll be done. So same as a human dentist would do, except we're leaving most of the structure intact, and so because we're not going to put a crown on him, so just a good standard root canal and everything will be done. He'll be happy, healthy, and the most important part is he'll be pain-free, and that's the biggest thing.
So one of the questions that we've seen is, how did we know that he had a fracture in the first place? So we thought that one of our husbandry staff here could talk about that.
My name is Rebecca Stites. I'm Shaka's keeper. We do regular behavior training with these guys. And one of the things we train them for is to open their mouth and show all of their teeth. And so when we do that, we can see if there's any chips or breaks or any sores in the mouth. And so that's one way that we were able to discover what was happening inside of Shaka's mouth.
And regarding training, are there any other operant trainings or medically related behaviors he does?
Yeah, pretty much all the training that we do is related to their health screening. And so we'll train for things like hand injections, so if they need their vaccinations, our vet staff can come down and just give them a shot the way we would get our shot. We never have to go in with them. They actually move their body to the front of their enclosure so that we can reach them. Another important part of their training is getting them ready for blood draws. So one way we can help monitor their health without completely anesthetizing them is to draw blood, and we can do that from the base of their tail. So my job is to work on having their tail come to the safe side of their enclosure, and then our vet staff will come down and they can draw the blood safely that way.
And speaking of blood, we are actually pulling some blood samples from the line this morning. There's some of our technician team here, Anne, Andre, and Peter. And where we're drawing the blood from on this line right now is the vein that we would request the line to present to us for voluntary phlebotomy or blood draws.
And Dr. Hall, we have some questions from Facebook.
Sure.
Some folks want to know if you can give a lion a crown.
Absolutely. Putting a crown on a lion would be, is doable. It's anytime we put a crown on, it's always 2 anesthetic procedures. And so most of the time, since they like to only have 1 anesthesia, we just do the root canal and don't do the crown. But if we were going to do a crown, we would shape the tooth, get impressions, but then we have to send out to a laboratory to have a metal crown made, and we would come back and cement that on later.
And how many teeth does a lion have?
A lion has the exact same number of teeth as a domestic cat. They have 30, they're just in stereo. They're much larger. Doing a root canal on a little cat, if we were doing the same canine tooth, the root canal length would be maybe 15 millimeters. In this lion, we're at 83 millimeters, and that's from this area, that's not from the top. So basically that's how long the root of his tooth is 83 millimeters. So that's over 4 inches.
Dr. Hall, some of the folks are wondering what you will use to fill the tooth with.
once we get everything cleaned out, we're going to use a material called Gutta Flow, which is a liquid type of gutta percha. Because this is such a giant opening, it's going to be easier to fill that area with this flowable material, and it's also a sealer as well. Once we get that filled in, then we'll close the access, and again, Shaka should have a healthy, pain-free tooth.
One of the things folks may notice is that there's a lot of people in this room, and while you don't necessarily need more than one veterinarian or one veterinary technician to anesthetize and monitor an animal, it's definitely one of the benefits of working in a larger team. So most of our larger animal procedures, we tend to have two groups. We have a technician who is primarily running the anesthesia component. In this case, we have Devin off to our right. And then we have technicians who are responsible for running some of the diagnostics, some of the imaging things, such as the folks you saw working on the hind end. We also will have one or two veterinarians associated with it. I'm mostly the narrator today, but our primary vet for the clinical procedure and anesthesia is actually Dr. Catherine Hope. Do you want to comment on anesthesia or what you found on your routine physical examination?
Well, this is a very young, healthy male lion. He has done great. He's been pretty stable and normal as far as his anesthesia and his induction. We had a exciting time getting him down. He was a little bit more rowdy than some of our girls are usually. So they've been, as Rebecca said, they've been working on training all of our lions for hand injections. He didn't want to stay for a hand injection this morning, so we got to use the dart a little bit. But he went down really quickly, and he's doing great. He's stable, and hopefully the root canal will fix his tooth, and then we'll take him back and wake him up. And as Dr. Neifer said, he'll be drowsy for probably early into the afternoon, and then hopefully by this evening he'll be almost back to normal.
And we have another question from Facebook. One of our viewers wants to know if we do a general cleaning while we have the lion on the table.
So as far as prophylactic cleaning, when we have a lot of our mammals under anesthesia for an examination, even if their teeth are in perfect shape, we do try to perform prophylactic scaling and cleaning, just like you would have done perhaps by a dental hygienist. I saw that along with that question was, how does this lion's breath smell? So not minty fresh would be safe to say, but if you have a lion that's got healthy teeth, normal gums, I don't know, Dr. Hall, how would you describe a lion's breath?
Oh, I mean, there's nothing abnormal. I mean, the tooth, as we've been instrumenting it, it's sort of got some nasty smells, but for the most part, I mean, his breath there's not really any type of bad smells or anything that way at all.
Now we do give our lions, in addition to their primary meat diet, they do receive things to chew on, bones, knuckle bones, which helps with dental health. They're also given enrichment items in their enclosure, which they will not only knock around with their paws, but they will also chew on. One thing I want to take an opportunity, people are always amazed at the relative size of animals. So I don't have a very big hand. I'm about 5'11", but it's always really cool to put your hand against another animal's just for perspective. So he's not the biggest lion, but he's certainly big. He's bigger than me. As with all cats, except for cheetahs, lions do have retractable claws. And there's always the concern, especially in an older animal, that they won't use their claws as much. If anybody has an older domestic cat, they may notice that they get overgrown claws. They have a tendency to get their claws snagged on things a little bit more, and maybe they need trimming a little bit more. And that's because they don't undergo the normal wear and tear that they would in the wild, or if they're a younger animal in an appropriate enclosure. I mentioned we have a lot of opportunities for enrichment, so our cats have the opportunity to climb, to jump, to run. So we really don't have a lot of issues. Actually, we don't have issues with their nail bed health. Even some of our older cats actually have quite healthy looking claws. We do find in captive animals compared to wild that their back claws will sometimes overgrow a little bit more just because they don't have the tendency to wear them down. They're not traveling the huge distances that they would in the wild. But I hope you can appreciate this guy's claws are actually in pretty good shape and are worn down nicely. If they're overgrown, we trim them just like you would your dog or your cat. They do have a quick, so you can't go back too far. You will get some blood. We also, when I mentioned full systems review, you know, one of the concerns we always have is, are our animals psychologically healthy? Are they being mentally stimulated? And so we worry about, are they pacing excessively? Are they doing stereotypic behaviors? One of the things that shows me this cat is not, he's got very healthy feet. The pads of his feet are nicely homogeneously colored. There's no abnormal wears or erosions. And so he's got very healthy pads. If anybody out there is a podiatrist, the feet are the window to what's going on in the body, and so is the mouth actually, where the dentists are concerned. And so aside from his broken tooth, his mouth looks great, his feet look great. He's a young, healthy animal, so he's really in the prime of his life here at the National Zoo. How much does he weigh? Can anybody tell us how much he weighs?
He's 195.
Yeah.
That's in kilos, so we're a little over 400 pounds.
And how do you know that?
We weigh him every week.
And how do you do that?
So he, in addition to being trained for blood draws and hand injections and opening his mouth, he's also trained to walk into a room that has a scale. He hops on the scale, he gets a reward for that too.
So our keeper staff, they're always very proud about what they do where training is concerned, but one of the most important things that they can do, if they do nothing else, is get their animals to step on a scale and give us an accurate weight. It helps our nutrition team monitor and gauge their dietary needs. It helps us more safely and accurately estimate anesthetic drugs that we will give these animals. We don't want to give them too much because we don't want them to sleep too long. We certainly don't want to give them too little because we don't want them running the procedure. So knowing their exact weight is a great thing. If this cat would develop diarrhea or vomiting or some other condition that required antibiotics, having an accurate weight is really important. Not so much because we're worried about giving too much, but we're worried about giving too little. We don't want to select for antibiotic resistance. We also want to make sure that the drugs we're giving actually are getting to therapeutic levels. So weights are a great thing. And then because carnivores in particular have some dental issues, the open mouth behavior is always another big behavior that we try to shoot for with our cats and our bears and our lions.
We have one more question from Facebook. Are we going to make any adjustments to Shaka's diet over the next few days as he recovers?
As in ice cream and donuts? Or no, actually, this tooth will be functional completely.
Oh yeah, absolutely. It's much better, I mean, than trying to extract the tooth. So he's free to do whatever as soon as he's able to.
If we had to remove a tooth, or there was more teeth involved and he was uncomfortable, we wouldn't offer him necessarily bones over the next several days. He'd probably just get his softer meat-based diet. Anything you guys do for him special post-procedure?
Yeah, he usually gets just half his diet on that first day, so we'll hold off on feeding him, and then we'll start little by little. So we'll offer him a meatball, see how he responds to it. He might decide he doesn't want to eat today, although I think that's unlikely with Shaka. He's a pretty big eater, and then usually he'll get half his diet today, and then tomorrow will be a normal day. Probably give him a little extra chunky if I can get that every day.
Do we have I guess we probably should take radiographs just to see what everything looks like.
Okay, folks. Well, we really hope that you've enjoyed this Facebook Live moment, and we probably have another 30 or 40 minutes of this procedure, and then we'll be transporting our lion back to his enclosure. As I mentioned, he'll remain anesthetized the entire time. The trachea tube will stay in place. The IV catheter will stay in place. That's both for his safety and staff safety. Once he's moved back to his enclosure, everybody pulls the equipment out that we use to monitor him. He will be turned off the anesthetic gas and maintained on oxygen for a certain period of time. Eventually, the oxygen will be turned off and he will be on room air. Once he starts to stir a little bit, we take his endotracheal tube out because we want to make sure that his trachea and his epiglottis is moving naturally on its own. Some of the drugs that we gave him today actually have reversal agents, so he will be receiving some reversal agents upon return to the building. And after that, it'll really be up to our keeper staff to monitor him throughout the day. We keep him on our active case list, which has all of our medical cases running through on a daily basis. We'll get an update on him tomorrow and make sure that he's doing well. If he needs any additional analgesics or painkillers, we can prescribe those at that time. However, given the particular lesion that he has in his mouth, his young age, and how well this procedure has gone, we don't expect him to have any challenges or problems. So thanks for stopping by.